is the Wizard News for Wednesday, May 4th, 2022. Musical accompaniment by Dave Stryker from the album As We Are. We often talk about healthcare systems that are not set up to serve marginalized communities, but rarely do we talk about what could be possible if we looked beyond current paradigms and imagined something different. Imagining something radically different is the vision of the Tubman Center for Health and Freedom. Launched in 2020, the South Seattle-based nonprofit believes it is not enough to address health at an individual level. You also must go further upstream to change the social determinants that lead to poor health in the first place. Tanisha Jefferson-Abye, founder and chief operating officer of Tubman Health, said the goal is to build a healthcare system that first listens to the community and then centers the needs of marginalized people. In every aspect of healthcare delivery, we're going to flip it and examine it and reimagine it, Jefferson-Abye said. Examples range from how electronic health records are managed and how appointments are scheduled to the look and feel of exam rooms and what is included in an annual exam. To serve its goal, Tubman Health is in the design phase of planning for a health center slated to open in 2025. The center will include a 25,000 square foot health clinic and a research arm, as well as a home base for community programs to change systems and advance health for marginalized communities. The organization was recently allocated $4.5 million from the Washington legislature for the purchase of land for the center. The clinic will be the only one in the region that is independent, Black-led, Black-run, and serving all ages. While some might want the clinic to open sooner rather than later, the founders are approaching the project deliberately and carefully to ensure they are truly operationalizing our mission. The planning process includes community visioning, design labs, and service simulations. One of Tubman Health's programs illustrates its unique method. The Blacksinate COVID vaccination clinic at the 2021 Juneteenth celebration at Seattle's Jimi Hendrix Park had comfortable couches, chairs, plants, music, snacks, water, and people greeting and welcoming visitors into the space. It looked nothing like the sterile and institutional community centers. All of that was by careful design. Knowing that generations of medical racism had created distrust around vaccines, particularly in the Black community, the Blacksinate team offered a safe, welcoming environment for people to get vaccines as well as ask questions about it. Instead of the typical routine where vaccine recipients go from one booth to the next, the Blacksinate clinics allow patients to stay in one comfortable spot while their clinical partners moved around to serve them where they were. They even found ways to put sharp containers out of sight so that those who were nervous about shots were not fearful. Jefferson-Abye said Tubman Health has held more than 20 clinics so far and provided hundreds of vaccines. In the process, she said, it received feedback from clinical partners who said, "Wow, we didn't know it could be done like this. We should have been doing it like this the whole time." Barbara Baquero, an associate professor of health systems and population health at the University of Washington, said, efforts like Tubman Health to transform systems are critical if we want to change outcomes. Health disparities are produced by the oppression and the structures that we have, she said. What I'm excited to see of this different model is that intentionality. Bakero said of the design and planning process that put the reins in community hands, staying there for the long run like this. This is going to take generations to change the way that we think about health. Inequitable systems didn't happen overnight and won't change overnight, but organizations like Tubman Health can help create a model for disrupting the failed status quo, city by city, community by community. The solution lies with us. We have the knowledge within our communities, Jefferson-Abye said. We need it resourced so that we can build an alternative. Source: Seattle Times, April 25th, 2022.